Hello, welcome to Myth Busting Mondays. My name's Simon, and today we want to talk about obsessive-compulsive disorders, otherwise known as OCD. I think the term "I'm a little bit OCD" can get banded around quite frequently in everyday language, and I think a study showed around about 40 to 50% of people sort of said that they believed they had OCD traits, which I think highlights a lack of understanding about what OCD actually is, and how people can confuse it with personality traits. So we're going to tell you bust five myths about OCD. Myth number one is OCD is all about cleanliness and all clean freaks have OCD. While common signs of OCD can be an obsession with cleanliness, such as constantly washing your hands or cleaning household items, a cleanliness complex can also just be a personality trait. And there's a massive difference. If it's a personality trait, then it's something that you may have control over. You're doing it out of sort of a preference. Whereas if you have obsessive-compulsive disorder, then you do not have an unrelenting anxiety. So yeah, that's a massive difference. And also a fixation on keeping things clean, maybe a common compulsion of OCD, but it's not the only compulsion that people have. Not everyone with OCD has a desire or a compulsion to clean, sorry. Other common compulsions include hoarding items, checking and rechecking that you've not made a mistake, and repeating routines such as walking in and out of doors several times. Myth number two is that stress causes OCD and people should just relax. It's not as simple as just relaxing and not obsessing. OCD incites uncontrollable fears and anxieties, and while stressful situations can exacerbate sort of symptoms in people, stress alone does not cause peace. Myth number three is that OCD is a women's disease. Now, I'm not really sure why this is sort of perceived the way it is, but men and women are equally likely to have OCD, and I suppose people, regardless of their ethnicity, sort of racial or economic background, they're also equally as likely to have OCD. It doesn't really have any sort of boundaries or preferences. Myth number four is that tests can confirm OCD. Unfortunately, unlike sort of physical illnesses like cancer or diabetes, obsessive-compulsive disorder can't be diagnosed with a blood test or a scan. However, your doctor is likely to conduct a physical examination and ask you a series of questions looking for 3 signs of OCD. So that's like whether you have an obsession, whether you exhibit compulsive behaviours, and if you do, whether they get in the way of your normal activities. And then finally, myth number 5 is that OCD isn't treatable. Many people don't seek OCD treatment because they're embarrassed, and that might be why people don't think it's treatable. However, OCD is definitely treatable, and the first line of OCD treatment is exposure. So it's like sort of face your fears type therapy, and there's also behavioural therapy and some medication as well that people often use to treat themselves and to allow them to get on with their everyday life. So yeah, hopefully that's helped you inform you a little bit about OCD. Feel free to hit up the site, sauws.org.uk /advice, and tune in next week for another edition of Myth Busting Mondays. Have a good day.